Hello, it's Khalid Sharif, consultant orthopedic surgeon with an interest in sports surgery, and this is part 2 of the painful hip in athletes. So today we're going to talk about a painful popping hip. Um, and as usual, please, if you do like the video, then give it a thumbs up, share it, subscribe, and send me some comments if you want me to address further injuries in this exciting channel. So let's dive in. So the popping hip, it can result from an internal problem in the hip itself or an external problem of the tendons around the hip. The problem inside the hip is usually resultant from a loose body in the hip, and that can result from either an osteochondral defect, degenerate conditions of the hip, or trauma. And the difference here is that the popping is not predictable in the position of the hip or the movement. It is very random. It depends on where the loose body catches inside the joint. It results in pain very deep in the hip, and it can if the loose body catches in a specific position, it can actually reduce the range of movement in the hip and may even produce a locked hip. The diagnosis here is via an MRI scan. I get an MRI scan and it will show the loose body in there. And the treatment is, there's no room really for conservative treatment here. It's through arthroscopy, you need to remove the loose body. The other diagnosis is what's called the coxa saltans, and that is either an interna or an externa. So we're now going to talk about the tendons around the hip snapping and catching. In the interna version, it's the iliopsoas tendon catching on the iliopectineal eminence, and that typically produces a snapping and pain in front of the hip, not deep in the hip. This is in front of the hip. And when you palpate in the front of the hip, you actually can demonstrate tenderness. It usually happens when the hip goes from a flexed position to an extended position. So it can happen in running, in walking, in jumping. I do a test for this, and the test is to bring the hip from a flexed, abducted, and externally rotated position to an extended and internally rotated position while I feel on the iliopsoas tendon in front of the hip for the snap and pain. The diagnosis here is I use ultrasound because it's dynamic. It will demonstrate the snapping of the iliopsoas tendon over the iliopectineal eminence. And the other diagnostic test is an injection of local anesthetic into the iliopsoas tendon. It will relieve the pain and sometimes even the snapping. The treatment here is conservative. The physiotherapy, non-steroidal anti-inflammatories. Sometimes you may need to release the iliopsoas tendon, although rarely, but if everything fails, then surgery will work. The other one I want to mention is the catching is the coxa saltans externa, where the catching is of the IT band or the gluteus maximus over the greater trochanter of the hip. And here the pain is on the side of the hip. It can produce a catching, a popping, and then a snapping, which is quite dramatic in this case. It can even be audible. It's visible, audible, palpable, and it usually happens when the hip goes from an extended position to a flexed position. So it can happen in people going upstairs, but can also happen in jumping and running. And the test I use for this one is I lay the patient on the side, bring the hip from a flexed position to an extended position, and then externally and internally rotate the hip while I feel over the greater trochanter for the snap. The diagnosis, again, through a dynamic test, an ultrasound scan, and the treatment, conservative almost always works here, but through physiotherapy, extension exercises, and non-steroidal anti-inflammatory, sometimes an injection of local anesthetic and steroid. If all fails, then lengthening of the IT band will work here. So as promised, I've done the part 2. There is another part 3. I will be talking about the sports hernia. I'll also mention the trochanteric bursitis, which are the other 2 conditions that can sometimes confuse the diagnosis of a painful hip in an athlete. Thank you very much, and I hope this is helpful.